The number of adults with dementia is increasing rapidly, and recent discoveries have shown that good hearing is closely tied to keeping our minds sharp and agile. Last summer, the ACHIEVE study confirmed this remarkable connection. Joining us with more information is one of the study's principal investigators, Dr. Vicki Sanchez from the University of South Florida. Thank you for joining us here today.
Thank you for having me and the opportunity to talk about the ACHIEVE study.
Absolutely. So what did the ACHIEVE study find?
Sure. So the ACHIEVE study is the first large-scale, long-term randomized controlled trial to evaluate hearing intervention with hearing aids on the effects of brain and other health outcomes. And what we found at those that were at increased risk of cognitive decline, though they also received the hearing intervention, we were able to reduce that cognitive decline. So in other words, treating hearing loss may be potentially a way to maintain good thinking and memory abilities as we get older.
Excellent. Thank you for that study. So has the ACHIEVE study changed how doctors view and treat hearing loss?
We sure do hope so. We hope that it's bringing awareness to how important hearing is. You know, good hearing is good health. So we would hope that all healthcare providers are considering the importance of hearing, asking their patients if they have any hearing concerns, and putting in referrals for patients to get hearing evaluations and appropriate treatment as needed.
And what does this mean for the average American with hearing loss?
Well, I think it means a lot for all Americans. So regardless if you think you have hearing loss, you should definitely get your hearing checked so you know where you're at and continue to protect your hearing if you have good hearing. Now, if you have hearing loss, it would be really important for you to be evaluated and to uptake the treatment that's recommended so you can hear the best that you possibly can.
And Dr. Sanchez, what's being done to address this link?
Yeah, so there's lots that still needs to be researched and discovered. We're trying to really understand the connection between hearing and the brain. We think that there may be a relationship between hearing loss causing cognitive load, which means that your brain's having to work harder to understand what's being said, which can have a negative effect on the brain function, as well as hearing loss is known to cause structural changes in the actual brain. And hearing loss makes people less likely to go out and be social, making them more isolated, which also is negative for your health and brain. So what we think is that hearing intervention can also decrease that cognitive load, help keep that structure healthy as possible, and increase social connections and opportunities to communicate, all of which would have a positive effect on the brain. So as we continue to evaluate that, we're trying to better understand how hearing intervention might benefit these elements, and also advocacy for hearing services for insurance and so forth. So patients can have not only evaluations, but also treatments too.
Where do we go for more information?
Absolutely. More information about the ACHIEVE study can be found at achievestudy.org. And more information about hearing aids and cognition can be found at phonek.com/cognition.
Thank you so much, Dr. Sanchez, for joining us here today on this very important topic.